Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Before we begin to discuss COVID today, I want to express on behalf of all Nova Scotians our deepest condolences to the families who have lost a loved one at sea while fishing on board Chief William Salas. And to the families of the rest of the crew who are still missing, our thoughts and prayers are with you at this very difficult time. And to the communities of Digby, Delapse, Cove and Hillsburn, and indeed all southwestern Nova Scotia, stay strong and stay together. Today we're reporting 4 new cases, all in Central Zone. 3 are connected to previously reported cases, and 1 is still under investigation. We currently have 55 active cases in our province, which means COVID is still here. But today we took a major step in fighting the virus head-on as we began to vaccinate frontline healthcare workers. I had the privilege to visit our first clinic this morning along with Dr. Strang. It was very impressive and exciting, and I want to thank the healthcare workers, the ones who were providing the vaccine, and of course those who were taking the shot in the arm. This is the first phase of our vaccine rollout. As more vaccine becomes available week after week, our clinics will spread across the province to ensure everyone has access to a vaccine. At a time in our province when for the last 10 months we've endured so much difficulty, the vaccination program that we've started today offers so much hope. It will take months, but we are in a better position. We just need to hang on and be patient. And that is what Dr. Strang and I are asking for as we head into the holiday season. We currently have restrictions in place that will be extended today to December 21st. On December 21st, 4 days before Christmas, we're making some changes. I'm not going to go through them all. Dr. Strang will do that. But this is what I want you to think about as you learn about the changes. COVID likes gatherings, and it likes movement. So if you get together in big crowds and you house hop, COVID will want to join you. So Dr. Strang and I have put our heads together to figure out how do we get you together as a family and also still protect you. And here's what we've come up with. On December 21st, you can travel from A to B, which essentially means that if your family lives in a different community, you can go visit your family at Christmas. And you can have up to 10 people total in your gathering. When you get there, stay there. We're doing this because we know how important it is for families to be together at this time. So we're asking you to respect the number and the advice on movement. Don't give COVID an excuse to join you over Christmas. We also recognize the importance it is for the residents of long-term care to see their families. We can't allow outside visits, but we are at long last allowing general visits into the home. It will be up to each home to manage the numbers. What's most important is that our loved ones in long-term care will finally get to see their families. Dr. Strang, I got to deliver some good news. I know you will add to it, and you'll add the other restrictions. So over to you.
Thank you, Premier. Good afternoon, everybody. And I, too, would like to express my sympathies and condolences to the families involved in the evolving issue around the scallop fishing boat. My thoughts and prayers are with you as well. Today we are announcing 4 new cases of COVID-19. The new cases are all in Central Zone. 3 of them are close contacts of previously reported cases, and the other case is under investigation. We do have active cases in all zones right now. Most of the cases we are seeing are close contacts of previously reported cases or are related to travel outside of Atlantic Canada. But I want to repeat what I said. We do have active cases in all zones in communities across the province at this point. We also continue to work closely with the company to respond to the COVID-19 outbreak at the poultry processing plant in the Annapolis Valley. All the staff have been tested, and we're working closely with the company on a reopening plan. And fortunately, so far, there's been no evidence of spread into the general community. So in total in Nova Scotia, we have 55 active cases of COVID-19, and fortunately, no one is in hospital. Since the second wave began on October 1st, there have been 341 cases in total, and 286 are now considered resolved. As we move into the holiday season, we are still seeing multiple cases a day, not just in HRM, but also in other areas of the province, as I just said. And while our numbers are lower, the virus is still here, which means that it has the potential to spread through social activities that go together with this time of year. Connecting with family and friends is important, and especially so at this holiday season. But this year, 2020, our holidays need to be different. We need to reduce our social activities. We need to keep gatherings small and the people who are at the gatherings as consistent as possible. We need to limit unnecessary travel and stay close to home. We need to avoid crowds, such as in shopping malls, stores, and avoid gatherings. With all these in mind, we are making changes to the public health restrictions. Our goal is to build environments that allow you to follow what I just outlined in terms of what we need to do to keep ourselves COVID safe. The epidemiology is telling us that while we can ease some of the restrictions in the areas of Halifax and Hants County, and at the same time we need to tighten restrictions around the rest of the province. Because, as I said, there are cases in all zones, and we do not want to give this virus an opportunity to spread. So first, the restrictions that are currently in place in the affected areas of Halifax and Hants County, and there's a few of those that are across the whole province, will remain in place until 11:59 p.m. on Sunday, December 20th. And here's what you can expect after that, from Monday, December 21st, up to and including January 10th. We continue to discourage travel in general. It is best to stay close to home. But effective on Monday, we are no longer specifically asking people to avoid travel in and out of areas of Halifax and Hants County. But again, we are asking all Nova Scotians to avoid unnecessary travel in general. We know for lots of people, the holiday often means travel within the province to visit family. We're not telling you that you can't. We are asking you to think twice about it. The less you travel anywhere right now, the better. But if you are traveling, drive there directly, minimize unnecessary stops, and when you get to where you're going, stay close to that home. We are also asking Nova Scotians to continue to avoid non-essential travel out of the province, and there is no change to the self-isolation requirements for people coming to Nova Scotia from outside Atlantic Canada. A 14-day isolation remains in place for almost everybody coming into the province. I know that Nova Scotians are social. We love to gather for a good kitchen party, especially during the holiday season. For the 3-week holiday period, starting this coming Monday, December 21st, you can only gather in your home in groups of 10 or less, and you can do that without the need for physical distancing. This is a rule no matter where you live in the province. It's the same whether it's Yarmouth, Halifax, Amherst, or Sydney. If there are more than 10 people in your home, that's fine. Nobody needs to move out, but it does mean that unfortunately, you can't have visitors. We know those numbers of families are going to be small. We know this would be hard, but the restriction is important to have household gatherings of no more than 10 to protect our overall safety and the safety of everyone in our communities. And with your household, when you go out into the community, you can go out in however many people are in your household, but you can stay together without physical distancing. But that's only if it's within your household. But we're asking that whole families shouldn't go into stores together if you can avoid it. Ideally, if you need to go shopping, just one person from your household should go into the store. This will help avoid physical distancing challenges for other customers and staff. Across the province, starting on Monday, you'll also be able to have close social groups of up to 10 people that, again, don't require physical distancing. This is not new. It's been in place since the summer, since we started the reopening from Wave 1. It was lowered to 5 in areas of Halifax and Halifax County. We are returning to 10 across the province. This group is typically the people you live with and maybe a few more. You should try to keep this group consistent. So if you are going to have social interactions with somebody outside your household, ideally it would be with one other group of people to make a total number of 10. It should not be one group today, another group tomorrow, a third group in a couple of days. Consistency is important. Avoid belonging to multiple groups. So these small numbers for social purposes, they apply just for social purposes. It doesn't apply to workplaces. So if you're doing things like skating at your local rink or having a meal at a restaurant, walking in the park, going to a faith gathering, you can go with this group of up to 10 and you don't have to physically distance. But a random group of 10 people should not just get together spontaneously. And I do want to remind businesses that they should plan to they should not plan to just seat 10 random people together. So a restaurant, it has to be 10 people who have chosen to be together to go in to be seated, rather than a restaurant saying the next 10 people get to sit together. Across the province for this 3-week period, we're also eliminating almost all gatherings. That means no informal gatherings in communities. It means no organized social events, festivals, special events, arts and cultural events, or sports events for the next 3 weeks starting on Monday. This is necessary to limit opportunities for the virus to spread. In recognition of their importance, especially at this time of year, we've made exceptions for faith gatherings, wedding ceremonies, and funeral services. These can have a maximum of 150 people outdoors, or 50% of an indoor venue's capacity to a maximum of 100. These events must be held by a recognized business or organization, and all the other COVID protocols, physical distancing outside of the close groups of 10, hand washing, screening, etc., all need to be in place. And while there can be wedding ceremonies and funeral services, there can be no receptions associated with them afterwards. So for the next 3 weeks, we are considering wedding and funeral receptions to be special events which are not allowed. If you do want a reception, it will need to be with 10 or less people at a home. In Halifax, the casino and the 3 First Nations gaming facilities will remain closed. Restaurants and licensed establishments in the existing restricted areas of Halifax and Hants County will remain closed for dine-in service. They can continue to offer takeout and delivery. In the rest of the province, restaurants and licensed establishments will operate with reduced hours. They must stop service by 10 p.m. and close by 11 p.m. This isn't a reflection of how bars and restaurants are being operated. They have been leaders throughout this, and I do want to thank everyone in the industry for their support, even as challenging as it has been for you from a business perspective. But what we need to do is reduce the chances that the virus has to spread between people. And so we need, in restaurants, we need to reduce, and licensed establishments, we need to reduce the longer social interactions where people are not wearing masks because they're eating and drinking. But if you can support local businesses by ordering a takeout meal or ordering delivery, I encourage you to do so. And I also encourage you to, as you're finishing up any Christmas or holiday shopping, go online, buy a gift card or buy an item that's delivered from a local store. We have many wonderful local artisans, crafts, a range of things that we encourage you to support Nova Scotians by buying locally. Continuing back on with the restrictions. I told you already that there will be no special events during the holiday period, and that does include sporting events and arts and culture events. However, practices and rehearsals can still happen, but with no more than 25 people, and that applies across the province. That means groups of up to 25 can practice or train or rehearse together without physical distancing, but there can be no games, tournaments, or performances. Physical distancing is not required for these because in a recognition that some intermittent contact is necessary for many of these activities. Across the province, fitness facilities, studios, and sports and recreation facilities can be open. Fitness facilities and studios must operate at 50% of their maximum capacity for in-person activities. Virtual sessions can continue and outdoor fitness classes can also happen. But regardless of the setting, whether it's indoors or outdoors at a fitness facility or studio, physical distancing is required. In addition, based on the fitness sector's reopening plan, we are requiring that these fitness facilities and studios keep a 3-meter or close to 10 feet distance between participants who are involved in high-intensity activities like a spin or boxing class. And in all fitness facilities and studios, masks must be worn except when people are actually exercising. In the areas of Halifax and Hants County, personal service businesses such as hair salons and spas can now go back to providing services like facials where the clients need to remove their mask. We restricted those a few weeks ago, but those can return. Across the province for the next 3 weeks starting on Monday, retail businesses must operate at 25% of their capacity. That has been in place for the Halifax areas. We're now expanding that until January 10th across the province. This will help avoid crowds forming during a period when there is traditionally a lot of shopping. And all the other rules for retail and shopping that have been in place in areas of Halifax and the Halifax County, we've a list in the public health order has a list of specific requirements, especially for malls. Those are now will be extended to the rest of the province. There's much more detail on our coronavirus website. We do know that people who are underhoused or homeless, often the only warm places that they have during the winter are public places like malls. So that's why we are reopening or asking them to remain open food courts while allowing all the COVID-19 precautions. We closed down food courts as part of the shutdown in Halifax, but I've had a number of concerns brought to my attention about the impact that this has had on people who are homeless or underhoused. So we're reopening food courts as a small way to help people struggling with cold weather, and often this is the only place where they can go during the day to be warm. We need to look after those who are most vulnerable in our communities. The Art Gallery of Nova Scotia, museums and libraries in the areas of Halifax and Hants County that were closed can now reopen at full capacity, but they have to maintain all the COVID precautions around physical distancing and the other public health measures. I know that our long-term care residents want to be with their families during the holiday season. We've gotten a lot of requests to allow people to go and enjoy Christmas dinner or something out in the community. But we need to keep our long-term care homes and people who live in them safe. So that's why we're saying this year we are not allowing residents to go home to visit their families over the holiday. There is just too much risk of them bringing COVID back into the facility. However, we recognize the importance of socialization, connecting with family for seniors or residents in long-term care facility for their overall health and their well-being, and we need to find a balance around COVID and their overall health. So we are going back to allowing 2 designated caregivers per person, and long-term care homes can also allow family and friend visitors. This will be in small numbers, which means that they may not be able to accommodate having every family member there at once. Each facility will manage the scheduling and the number of visitors based on their capacities, and we ask families to be understanding and patient with each of the homes that they may want to visit. I'm going to shift topics now to talk a little bit about vaccines, and this has been a really important week on the vaccine front. Most people are probably aware now that we received our first shipment of 1,950 doses of Pfizer vaccine yesterday. This vaccine has to be kept at an ultra-low temperature and can't be moved in any distance from where it is stored. And it's because of those restrictions that we started today in our central zone immunizing our priority groups. As the Premier said, he and I were there this morning, and it was quite something there. It was actually quite emotional this morning. Talking to staff, it is inspiring. This vaccine, while it's a long road till we get everybody immunized, this vaccine is a signal of hope. And to talk to staff and who have been working, my colleagues in public health, and there were also occupational health staff there from the health authorities, they have been working flat out for 10 months. But to them, being able to be part of starting to immunize was giving them hope, was giving them inspiration. And that really touched me. What also touched me was, once again, 3 weeks ago, we weren't sure how we were going to do all the vaccination. We've come so far in 3 weeks, and to see, both in the health system and across government, everybody put up their hand and say, what can I do to help? The collaboration that has happened yet again that I've seen throughout the COVID response, to see how things have come together, including the significant support we're getting from our Canadian Armed Forces, who are an important part of our community. Again, to be able to see all that coming together and to see vaccine going into people's arms was quite to me, it was somewhat emotional. I do want to recognize that when I'm talking to people there, that we have public health nurses and other people in the healthcare system who have had to put aside their planned Christmas vacations for the next few weeks so people can get immunized. And I hope people will understand that what's the sacrifices that are continue to be made in our healthcare workers, and when they're thinking about why they may need to follow COVID precautions, if you need any other if you don't listen to the other reasons, think about the healthcare workers in this province who are willing to say, I'm not going to have Christmas with my family like I planned because I need to be there helping people get immunized. They're there sacrificing for you. What we're asking the people to follow is not too much to ask, given what other people are doing to help you be safe. So this month and into January, we'll be offering vaccine to frontline healthcare workers in hospital-based COVID-19 units, emergency departments, critical care units, the birth and early labor units at the IWK Health Center, and our regional long-term care treatment units. And long-term care staff and designated caregivers in Central Zone, we're going to find ways to get vaccine to them as early as we can. And then as we get more vaccine with less restrictions on it in January, we'll be able to move the delivery of COVID vaccine in the long-term care facilities in January. We are anticipating getting small weekly shipments from now until the end of March, roughly 150,000 doses in total, which is enough to immunize 75,000 people. I use those numbers to point out that there's almost 1 million of us that need, so we need 2 million doses of vaccine ultimately. So this is a long road ahead of us. It's months while we do this, and we need everybody to be patient. We also need people to recognize that the public health protocols that we have in place to protect us all from COVID are going to have to stay in place for a while yet. A vaccine does not change that, at least not in the short term. So the federal government has said that their goal is to have all Canadians who want a vaccine to get one in 2021, and they've targeted by September. So between now and next fall, we will be, this is a priority in Nova Scotia, but we are asking Nova Scotians to be patient. You will get vaccine, but you may not be first in line. Understand why we are prioritizing those at highest risk. And there's lots of people saying, I'm essential, I need vaccine. We will get to your groups in a planned, logical manner based on an assessment of the priority that you fit in, but everybody will ultimately get a chance to get vaccine. So we ask for your patience. We ask that for your vigilance to continue to stick with the COVID protocols while we get through the delivery of vaccine. And we'll be able to talk more about this as the months evolve, as we get more research coming in on the immunity and other aspects of the vaccines. But the message is we cannot give up the COVID protocols while we roll out the vaccine. So we're asking for everybody's cooperation and engagement on that front. I do want to let people know that we have extended our asymptomatic testing across the province at least until this Friday, and the health authority is actively working to be able to extend that throughout the holiday season and beyond. And we're also working to continue our pop-up testing sites. Our strategy of asymptomatic testing is in many ways leading on the cutting edge of our COVID response in the country, and we need to look at how we continue that in the weeks ahead. So if you haven't already been tested, you can go online and book a test if you live outside of Central Zone, or you can drop into the Zatzman Sportsplex in Dartmouth if you're in the Halifax area. You can find out when the Zatzman Sportsplex is open by going to nshealth.ca/coronavirus testing. And I do want to thank everyone who's come in for a test, whether it's at the Sportsplex, the primary assessment centers, one of the mobile clinics, which today was down in Berwick today, continuing to do testing associated with the outbreak in the poultry plant, or to one of the rapid pop-up testings that our partners are holding. The willingness of people to come forward and be part of this testing, and the reasons they're giving. Many people are saying, I can't do much else, but I can actually be part of the COVID response by coming forward and being tested. That's, to me, is an illustration of the attitude we have had in this province. The attitude we need to sustain is that what can I do for everybody else? How can I show caring for everybody else and doing what I need to do to keep us all safe from COVID? So I recognize we've shared a lot with you today. All the details will be on our coronavirus website. Some of that news is welcome. We're loosening some restrictions in Halifax. Some may not be so welcome. We're tightening down in some areas. In other parts of the province, people may feel that we're taking something away. But I want to emphasize that I recognize this. And that for many people, there's some disappointment that we're not going to be able to have the kind of holiday we expected, and I recognize that that's hard for folks. But we are in the middle of a global pandemic, and we need to expect things to be different. We've actually done a really good job in Nova Scotia by keeping ourselves safe. Now is not the time to let all that go just because we have the desire to have holidays like they used to be. We'll get back there. And I've said it before, I'd like to have everybody who's here today in Nova Scotia be around next year in Nova Scotia to celebrate Christmas in a different way, to celebrate our holidays in a different way. But to do that, we need to make sure that we're all safe so we don't lose people along the way. So our gatherings need to be smaller. We need to stay closer to home rather than doing lots of visiting. We need to make our time in stores as brief as possible and only for the necessities. But our gatherings can be small and still full of love. There are ways to see our loved ones from across the province and around the world without leaving our homes. So the best holiday gift we can give this year is a gift of good health, of safe communities, not just for our families or friends, but for each other, for all Nova Scotians. We have shown so much kindness and compassion in 2020. Nova Scotians have found ways, big and small, to show how much you care for each other. You've stepped up to help others who need a hand, and you've made so many personal sacrifices to keep each other safe. And I know that you'll keep doing that throughout the holidays. The friends and family we gather with over the holidays, they tend to be the people we trust the most, the people with whom we feel safest. A chance to shake off our worries and let our guards down a bit. But feeling safe with the people we love and being safe from COVID-19 are two different things, because this virus is a stealth agent. And so the only way to be safe is to limit our social interactions, gather in small numbers, and stay close to home as much as we can this year. Our actions don't just affect us and our families, they affect everyone. Our neighbors, our healthcare workers, and other essential workers, the most vulnerable and marginalized in our communities. So for this holiday season, please focus on putting others first, show caring and compassion, and please do the right thing. Premier.
Thank you, Dr. Strang. Tina, we have to take any questions.
Just a reminder, we'll take one question and one follow-up from reporters on the line in the allotted time that we have for today. A reminder, if you're not on mute, please ensure you are on mute now. We'll start with Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, could you talk a little bit about when we can expect to see the next shipment of Pfizer vaccine in Nova Scotia and how many doses it will contain?
So my understanding, I don't have all the details in front of me, my understanding is we're getting another dose of 1,950 on Monday, and we're going to expect to see weekly allotments of that much or more on a weekly basis up until the end of March.
Go ahead, Natasha, with your follow-up.
Okay. Could you also explain a little bit about how, I understand the Pfizer vaccine requires 2 doses 21 days apart, and in this initial shipment, you're actually vaccinating about 2,000 people with this first shipment of the vaccine, but after that you're holding half of the shipment back each time to provide that second dose. Can you explain why that decision has been made?
So we've got the assurances from Pfizer that with at least this initial allotment of 2,000, that we'll be able to get that 2,000 for the second dose. They're being very cautious. They're not able to give us that same reassurance for the subsequent shipments. We believe we will get that, but I don't want to be in a position where we've overextended ourselves, if you will. We've given all our vaccine for people, and then we don't have assurances that they can get the second dose within the 21 to 28 days that's required. We're taking a conservative approach, and all that's based on we have the clinical trial data showing strong effectiveness is based on 2 doses. There's not a lot of information to really say how much immunity you get from a single dose. So we don't want to be in a position where we've immunized people with 1 dose and all of a sudden we can't give them the second dose to give them the level of immunity we want to. We will ultimately have enough vaccine to give everybody who wants a vaccine 2 doses, but I want to focus on, to me, it's the cautious approach is to focus on getting people 2 doses, because we know with that 2 doses they have assurance at least of short-term immunity, and we fully expect as the clinical trial data goes along, we'll get more and more data that shows that immunity is sustained over a longer period of time.
Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Thank you. Just as we're loosening some of these restrictions, that's certainly going to make some people happy, as you say. I'm just wondering, does that indicate that maybe the second wave, we I guess conquered's not maybe the right word, but are we kind of past the second wave, and are these new restrictions, Dr. Strang, that you're talking of, are you anticipating maybe a third wave now following the Christmas holiday?
So what we're keeping in place actually is to try to minimize any resurgence after the holidays. We certainly have with people's actions and the restrictions in the Halifax area have had a very strong impact. We brought that significant surgence in the HRM area under control. But as we've said, we still have virus in Halifax and in other parts of the province. We are still in the second wave. And if we're not careful, if we just allow ourselves to get relaxed and start gathering again, allow the social activities, we will almost for certain have another spike in January. So our whole process is to get ourselves through the Christmas period as safely as possible. In early January, we'll be looking at where are we at from the epidemiologic perspective. All the restrictions are in place to January 10th, so in early January we'll be assessing where we're at and looking at whether we need to extend restrictions, whether we need to loosen some restrictions. But the whole goal now is to keep things as safe as possible to allow us to get through the end of 2020 and start the new year in a very safe place with COVID and keep ourselves as safe as we can while we slowly get the vaccine into people's arms and slowly build up the herd immunity from vaccine.
I think it's important to recognize that Nova Scotians have worked hard over the last month to ensure that we continue to flatten the curve and bring the numbers down. But I don't think anyone should mistake the decisions that are made today as the fact that we think we've conquered COVID. Couldn't be further from the truth. And I don't think anyone should misunderstand what's being said here today. If we see any increase through the epidemiology, we will not hesitate for 1 second to take very tough restrictions. That has been our success. It has hurt some people's businesses and other aspects. It has kept families away. We've not been able to mourn the people we've lost this year. But don't ever think, and I want this for the listeners, that we've conquered COVID. COVID will be with us. It'll be in our neighborhoods. It'll be next door. Think about it in that sense. What we're trying to do is to allow families to get together in small numbers over the holidays. But if we see a spike, do not misunderstand this. We will do whatever we have to take swift action to bring this virus back under control.
Go ahead, Jesse, with your follow-up.
Thank you. I just was going to try getting some more clarification around restaurants. I know maybe just the rationale for not allowing dining until January 11th, but I'm also wondering more clarity around the fitness facilities in HRM in the Hants County. Are they having to remain closed?
So let's talk about first. The restaurants. We've had discussions with the restaurant sector. They are okay with keeping them closed in the Halifax area. They understand the rationale is that closing them down was a big part of our ability to get things under control again in Halifax. Again, it's not because of what the bars or the licensed establishments and the restaurants were doing so much, but by nature, their business brings people together and brings people together for prolonged period of times, and because they're eating and drinking, they don't wear masks. We had to close that down. It's the safest thing to do to keep that closed down to allow us to get through the next 3 weeks and start off 2021 on the safest possible place. The restaurants have, while they acknowledge it's an ongoing financial challenge, I want to give credit to them for being willing to come to the table and say we're willing to continue to be closed down in the Halifax area, understanding the rationale. In the rest of the province, we're actually reducing their hours. Again, this is all about allowing people to dine if they choose to, but not having the late night activities, and so they're open till 10, closed have to be closed, or sorry, they can service stops at 10 p.m. They have to be closed by 11. For the fitness, sports and recreation fitness facilities, they are open across the province. So we're allowing them to remain open outside of Halifax. We're opening them up in the Halifax area. But there are some limitations for fitness facilities and studios. They have to be at 50% of their maximum capacity, and that's across the province. We've also, based on their proposal, we've also requiring what they define as high-intensity activities like spin classes, etc. They actually have to have a physical distancing not of 2 meters but of 3 meters. And that was part of their proposal. So we're opening things up in the Halifax area, putting some more restrictions on outside of Halifax, but we have certainly a much more equitable and common approach across the province in most areas.
Next, I'll go to Mike Gorman from CBC. Go ahead, Mike.
Dr. Strang, how much of that shift to a more common set of restrictions across the province is intended to balance the easing of the travel advisory and perhaps an acknowledgement that whether you did that or not, there was a high probability of people traveling throughout the province during the holiday season?
So we recognize that people there is going to be people who travel. We're encouraging people to really think cautiously about their travel, and if they do travel, to do it in as safe a manner as possible. I think it's not so much the travel, but the recognition that what we've seen, a month ago, COVID was very much a Halifax-based issue in a certain age demographic. We've now shifted that. We're seeing pockets of COVID and individual cases with household contacts in communities across the province. And we were dealing with an outbreak in a large workplace in one part of the province. So it's, as the Premier said, we all have to be thinking that COVID could be in our backyard, in our community. Whether it's there or not today, it certainly has the potential to be there. And so we're trying to, we're recognizing that with that shift in the wave 2 from a more of a Halifax base to a provincial basis, we need to have the same level of very cautious restrictions applied across the province. The easing of restrictions in Halifax is a recognition is that the risk has come down in Halifax, but we're at the same level of risk as we are across the province now in Halifax.
Go ahead with your follow-up, Mike.
Thanks for that. You spoke, Dr. Strang, about the need to balance certain considerations when it comes to the long-term care homes, and you're, if I'm not misunderstanding you, you're letting more people go in there for visits. Why does it make sense to do that before you've had the opportunity to vaccinate residents and the staff who work there?
So we're recognizing that we have there's layers of other protection in long-term care facilities. Facilities first and foremost are going to limit the numbers of visitors. They'll choose the numbers and the scheduling of visitors that actually work for them as a facility. But every visitor who goes in has to be screened for going through a COVID screening. They have to wear masks. They have to do hand washing. There's a number of protocols in place in the facilities around where people can and cannot travel that provide multiple layers of protection already around COVID. If I feel, while I talked about risk of COVID, it could be anywhere, our epidemiology is fairly low and stable. I'm comfortable that we're allowing some visitation into long-term care facilities with the other other layers of protection we have in place. It's a recognition of, if you look across the country, there's been a lot written about how long-term care residents had significant impacts on their physical and mental health by very tight restrictions and no visitation. So we're working to find a balance, addressing those needs, but also having appropriate levels of COVID safety. Certainly once we get vaccination into people, we'll be able to relook at things, but that will take some time.
Next, we'll go to Nabal Sman from the Chronicle Herald. Go ahead.
Good afternoon. So I realize that people were sent specific appointments for them to come and get vaccinated today, but I'm just wondering if there was a specific reason why Danielle, she's the registered nurse, was chosen to be the first healthcare worker to receive the vaccine.
I can't answer that question. I'm sure that was just an operational decision. Somebody had to be the first. She was amongst the groups that were chosen. She's, my understanding, she works in the COVID treatment unit at the Halifax Infirmary, which is clearly one of the groups we need to get immunized. And she just happened to be perhaps the first that got her first name on the appointment.
Go ahead with your follow-up.
Thank you, Dr. Strang. I was wondering if there were any supports specific to Nova Scotia that are available for healthcare workers if they get fever or fatigue or any other side effects from the vaccine.
Well, we know from this vaccine that some people will get some mild symptoms, whether it's a sore arm or slight, some, as you said, some feeling fatigued or a bit of chills. Those are generally limited and short term. So we're not anticipating that this is going to have an impact on people needing to take time off work, if that's what you're alluding to. We also do have a robust process. If somebody has an unusual or more severe adverse event, we have a very robust process about that, how that is reported and recorded. In the province, there's an assessment made, and we also, every province and territory passes that information along to the Public Health Agency of Canada. It's all part of a robust system around what we call vaccine vigilance, looking for adverse events that may or may not be associated with the vaccine, but it's important that people understand that with this new vaccine, like we have for all vaccines, we have a robust system for looking for signals that there might be some unusual adverse event that's associated with the vaccine. I'll use the example of a few weeks ago. There was a few cases of an adverse event related to one lot of flu vaccine. That lot of flu vaccine was very quickly pulled, not just in New Brunswick, but in Nova Scotia and other provinces. And earlier this week, we finally got the results of the assessment that those adverse events were not at all related to the vaccine. So we were able to start using the vaccine again. But as soon as there was something detected, we took the cautious approach, stopped using the vaccine until there was a more scientific assessment. I just use as an example to again reassure people that we have a very robust vaccine safety process in Canada.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. For Dr. Strang, recognizing the importance of privacy around our COVID cases, can you indicate broadly how many of our cases have come from spread in restaurants and bars?
I don't have that breakdown. We don't generally report. Look at in often cases that we cannot say definitively that there was a bar or a restaurant was the sole cause. Most of our cases would have had multiple exposures, especially when we had the big surge in Halifax over the last month. They had been in multiple bars or multiple licensed establishments. They'd also been at private parties. Some of them had also been at other community places where they could have been exposed. So in many of our cases, when there's, when the people have had significant social activity, that was the explanation of why they got exposed. It's very hard to pin down to their exposure to one specific establishment or one specific type of establishment.
Go ahead, Lindsay, with your follow-up.
Thank you for that. For the Premier, I'm hearing from some small restaurant owners who are quite concerned about how they'll stay afloat. I'm wondering if there are any plans to expand support systems to those businesses which won't be open for dine-in until at least after January 10th.
For the ones that we've closed, Minister McClellan and his department actually did another round of working with them and looking for supports.
Next, we'll go to Yan Lang from Radio Canada.
Thank you. My question is for Premier. What's the measure or plans you have to guarantee that there will be 70% or more than 70% in population in Nova Scotia get the vaccination?
So that 70% was given by Dr. Watson Creed. That's the minimum target that we feel we need to have Nova Scotians. Our plan is to make sure that we have easy access over the next number of months for all Nova Scotians, that all Nova Scotians have access to good information, and access to have any questions they have about the vaccine answered. And we're building all those communication tools right now. As I said, we've only started this in the last few weeks. We have lots of work to do, but I think the combination of ready access as well as good information and helping people understand, we'll get more information as on all these vaccine products as the clinical trials, which are underway, which have given the evidence to allow them to be licensed. As those clinical trials extend, and as we get experience of using these vaccine products in the early part of the program in Canada, we'll share all that information with Nova Scotians. I fully anticipate that the majority of Nova Scotians are going to understand that we have, like other vaccines, we have a robust process to deliver a safe and effective vaccine. As I talked about just now, we have a robust safety, vaccine safety program, and that the vaccine offers nothing but a positive message and hope about how we can ultimately bring the COVID virus under control.
Go ahead with your follow-up.
Have you ever discussed about like a COVID-19 immunity passport, this type of measures?
So I think that the immunity passport that's been talked about is a bit of a flawed idea. We don't know enough about the vaccine yet to be able to say, if you've been vaccinated, you can do certain activities, or you can be less, you don't have to worry so much about your COVID precautions than somebody who hasn't been vaccinated. We don't know yet that the vaccine studies have been done to show that the vaccines are very effective about preventing symptomatic COVID disease. We don't know yet whether the vaccines actually will stop people from being asymptomatic but still being able to transmit the virus. So until we get more knowledge, the idea that somehow proof of vaccination will allow you to have be less restrictive in what you can do or the protocols you have to follow, it's premature for that. I would also be concerned about doing that, and we're all setting up kind of almost two classes of citizens, those who do not, those who have vaccinated and those who don't.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Dr. Strang, you just said a little while ago that there's the same level of risk across the province as there is in HRM. So I'm wondering, given that the risk is the same, why are there two different sets of rules around restaurants and bars? And are you worried that people might drive from Halifax to other places in the province and there might be an associated increase in drinking and driving?
So there's the same general level of the possibility of COVID. We recognize that in the Halifax area, we had a significant surge of COVID that we're coming out of, but we have to be very careful. That COVID, part of the challenge is in an urban environments where you have lots of people, a much greater number of restaurants, etc. We saw a lot of movement of people with multiple restaurants, multiple licensed establishments, and then if we open those up over the Christmas holidays, then we're putting ourselves in a position, I would say, of increased risk of people starting to go back to those socializing behaviors with multiple establishments, etc., which could then put us back very quickly where we were a few months ago or a few weeks ago in Halifax. That's very much, or if you look across the country, that's much more of an urban phenomena. So that really is the rationale of why we need to be extra cautious around bars and licensed establishments and restaurants in Halifax. Keep them closed for 3 more weeks. Hopefully, as we do the assessment in January, we can start to then be more relaxed. But we'll get to that when we get the epidemiology. It makes sense to reduce the hours, especially those late night hours in places outside of the city, because that's where the real risk starts to happen. Where you've had people are going, there's more alcohol consumption, and much less masking, and much less respecting the requirements for physical distancing, etc.
Next, Tim Bousquet. Do you have a follow-up?
I do, and it's around the mental health exemption that you've stated for students. My understanding is that if a student from Ontario goes to school in Nova Scotia, they go home for Christmas, they come back, everyone in their household has to self-isolate for 14 days. But a student who lives in Nova Scotia goes to Ontario to university, they can come back for Christmas and everyone in their household is not required to self-isolate. I'm wondering if there's an epidemiology reason for that, or what the logic is for treating the two kinds of students differently just because of where they happen to live.
So the students who are coming back to the province, who said if their primary home is in the province and they come back to be with family for the holidays, as long as there are protocols in place, and this is all spelled out on our website, that the student has to stay in quarantine. And as long as they can be in that house or that home and not have close contact with the rest of the house, the rest of the household doesn't have to go into isolation as well. Students coming back to study if they go away and they come back after Christmas, they're all going to have to go and undergo 14-day quarantine. Many of them also live in student housing. They have to have a quarantine plan that's reviewed by the university. And if there's other people in the house who are in the same situation, or they can't, or the student who's required to quarantine can't stay isolated from the rest of their roommates, or then that whole household will also have to isolate. So I think the rules are the same.
Just before we go to another question, I was asked a question by, I think it was All Nova Scotia, about whether there would be supports for businesses that were closed by the order. The answer to that was yes. Some of you didn't, wasn't clear enough, I guess. It's very similar to the program that we announced earlier in the spring. It would just do a second round, and it will only apply to those that have been ordered to close by Dr. Strang, which means really it's the Halifax region. The programs and the protocols around the amounts are all the same as they were in the first 2 rounds that we did.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thank you. So I kind of have a question about some of the language in the release and just the difference between things like a social gathering versus a personal gathering where the limit is 10 people. But I'm wondering what makes the difference between, say, a personal gathering that is permitted but a social event that's not. Is it whether it's in a home or not? And kind of the same goes for, say, like a sports gathering where we say practices are permitted but sports events are not. What makes something go from that level of being permitted, being okay under these new regulations, but or not?
Let's start with the home. So you can have in a home or a house, you can have up to 10 people and have a social gathering. We're recommending that if you do that you be careful about who actually is part of that. People who are at increased risk because of their age or health conditions have to be extra careful about who they gather with. Also the consistency of if you're going to gather with folks, don't gather with one group one night, another group another night. Consistency is important. So you can have household or home gatherings of up to 10 people across the province. Outside of that, we've said really no gatherings for the next 3 weeks. You can go out with your family, go for a walk, if you need to go, those kind of activities, outdoors especially. If you need to go shopping for essentials. But we've said organized gatherings, special events, social events, festivals. We've said sports and theater, and that pertains to the audience. That we're not going to allow those for the next 3 weeks. We have to be very careful about how people are allowed to come together. But we're allowing the household because we recognize that that we still have to, people have to have some social activity, but we're doing it in a limited way. When it comes to but we have made the exception for the reasons I outlined because of their importance and their significance, especially at this time of year, faith gatherings, and we're also allowing weddings and funeral ceremonies, but not the receptions. Again, there are special circumstances that allow those. They're not really social events. They have much more importance than just a general social event. And then for the sports, we've said the sports and arts and culture, we recognize that people need to be, we need to have ways for people to be physically active, both for their physical and their mental health. So people can get together up to 25 without distancing, and that without distancing is important because these activities require some, playing. People in a hockey practice need to be in close contact, but up to 25. But only for practices, for training, or rehearsals. So accommodating, and those aren't social events, but allowing people to get together for other purposes, which are important for our individual and our collective health. I hope that clarifies for your question.
Go ahead, Victoria, with your follow-up.
Yeah, I guess I'll follow up, I think, on kind of that same thing, and where we're talking about religious events, which we've said are so important to so many people at this time of year. But kind of what was the decision of, why is a religious event more important to people right now than a cultural event, for example? And what is the marker between what's a cultural event to some people and what could be a religious event for others, or religions that aren't mainstream right now who are having what wouldn't be deemed a religious event but a cultural event, and will those not be permitted?
Well, we were calling them faith gatherings, so whether it's a church, a synagogue, a mosque, etc., those are very important for people. So allowing those to continue, and I see that are there a cultural event? I think most people can distinguish between a cultural event like a play, a recital, etc., from a faith gathering. So we recognize that we made the distinction because of the unique importance of faith gatherings, but also as well as accommodating weddings and funerals, the ceremonial or the service part of those, but not the reception part of those.
We have for questions today. Go ahead, Premier.
Thank you, Tina. The holiday season is a great time to gather and celebrate, but not this year. It will be very different. And while our case numbers are low, back in the single digits, the fact is COVID has not left our province. And as Dr. Strang said in his opening, it is in every one of our health regions. And if we've learned anything, COVID loves gatherings. The more people it can come in contact with, the better COVID likes it. That's why we can't do what COVID likes. We cannot like having big gatherings or big parties. We have worked too hard and too long to stop now. I want to thank all of you for getting us to this point. We are heading into the holiday season with very low numbers in our province. That's because you followed the protocols and respected the restrictions that we've placed on you. You can still get together with your family. You can still share love and stories, but just in smaller groups. And I think you would agree, 10 is not bad. To the businesses that have been affected by these restrictions, we are very sorry. And we want to thank you for your understanding and your cooperation. This will be a hard time for most of us who normally enjoy Christmas season in a big way. But for many people in our province, those who've lost loved ones, those without family, the homeless or the less fortunate, this is always a very difficult time of year. How about instead of lamenting about what we don't have or what we can't do, let's find a way to express our gratitude by giving a little more to those who have a lot less. And something that doesn't cost money at all is a smile, a thank you, and of course, love and kindness. Dr. Strang and I will be back here on Monday. I hope you have a great weekend. Please stay safe.